series, Amplify Your Voice, Control Your Care, as we continue with topics that provide useful tools to control your healthcare. Today's presentation topic is Marketplace Open Enrollment. The marketplace and individual coverage in general can be quite confusing. Therefore, this topic will help clarify some of the questions that you, your family members, or clients may have about this very important enrollment period. I'm Amy Jackson, Case Management Specialist with Accessia Health, and your moderator for today. Thank you for joining us. Before we get started, I would like to cover a few housekeeping items. First, all lines have been muted and will be throughout the duration of the webinar. However, we welcome you to submit any questions during the event using the Q&A feature located on your screen. We will have time at the end of the presentation to answer your questions. However, please note that only general questions will be answered. For questions regarding your specific situation, please utilize one of the resources that will be provided here today for assistance. For the convenience of some viewers and for those who are hearing impaired, closed captioning is available and has been turned on. This webinar is being recorded and will be available for your viewing at accessiahealth.org. Also, you will see polls throughout the presentation, and we encourage you to participate as they pop up. And lastly, please review our full disclaimer on your screen. Accessia Health webinars, events, and conferences are intended to provide information to the public. The views and opinions expressed by any speakers or other third parties are not necessarily those of Accessia Health. Now, I am pleased to introduce our speaker for today. Jessica He first started as a corporate trainer in 2013 with General Dynamics Information Technology, instructing customer service representatives about the Centers for Medicare and Medicaid Marketplace and how to assist consumers throughout the process. Today, as a part of Maximus, Jessica supports Marketplace as a liaison between CMS and the Maximus contact centers. She works closely with CMS and its partners to help plan and track major initiatives and legislation, and to understand the impact initiatives like the American Rescue Plan Act have on CMS Marketplace offerings. Welcome, Jessica.
Thank you so much, Amy. I am so excited to be here today and to go over the marketplace and the current open enrollment period with you. And today we are going to start off with a quick poll. And our poll question is, how much knowledge do you have about the ACA or the Affordable Care Act? So we've got some options for you. If you'll select one of those options, we'll give it just a minute here. Just another minute, give everybody a chance to answer. Okay, so what do we have? So we've got some folks that know a lot about the ACA. We've got some that have some knowledge and a little, and then we've got some folks that have no knowledge at all. Well, hopefully in today's presentation, those of you with little knowledge, you'll learn enough to kind of be able to take some control of your healthcare if you need to go through the marketplace. And hopefully those with a lot of knowledge will learn at least something new today. So let's start off just by going into what is the Affordable Care Act. So the Affordable Care Act, or the ACA, is the actual law that was passed in 2010 that created the health insurance marketplace, and it set new regulations around things like cost and coverage for health insurance. It also introduced new provisions that prevent additional costs for individuals with pre-existing conditions, and created some new regulations around preventative services. So really the goal of the ACA was just to expand access to healthcare to millions of Americans. Since the ACA was passed in 2010, there have been several additional laws and executive orders, like the American Rescue Plan, that have extended access to lower costs and coverage through the marketplace, and programs like Medicaid. One thing I do want to call out here is that for today's presentation, we will be specifically referring to the federally facilitated marketplace, or the FFM, and there are some states that run state-based exchanges. A lot of the provisions are going to be the same, but if you're in a state that runs a state-based marketplace, you're going to want to check with them for any specific details or follow-up that you can do with enrollment. So we won't be touching on that piece today. There is an awesome link at healthcare.gov where you can check to see if your state is state-based exchange, and if it is, it'll actually link you out to your state. So very cool resource on healthcare.gov. Now that we've talked about the ACA, let's talk a little bit about what the health insurance marketplace is. The health insurance marketplace really is a one-stop shop to help you fill out an application, determine your eligibility for financial assistance, decide how much of that financial assistance you want to use, compare plans, and enroll in coverage. The marketplace does not offer health coverage. We are a liaison between you, your eligibility for financial assistance, and health insurance providers, health insurance companies. So you may be familiar with like Medicare or Medicaid, and those entities do actually offer the insurance, whereas we do not. We're the middleman. We help you understand your options and help you get enrolled in a plan that will meet your needs. I want to touch on a couple of the key terms that you might hear or you might see as we go through this presentation. We have a lot of acronyms, so I want to give you a chance to understand what those acronyms are up front. The first one is Open Enrollment Period, or OEP. We have Special Enrollment Periods, or SEP, Advanced Premium Tax Credits, Cost Sharing Reductions, Eligibility Determination Notice, Window Shopping Tool, Federal Poverty Level, and Data Matching Issues. These are kind of some of the big ones that you might see, and I may inadvertently say some more as we go through, but I'll definitely do my best to make sure that I'm spelling those out for you as well. So let's talk a little bit about enrolling in coverage, and specifically the enrollment periods. So currently we are in the Marketplace Open Enrollment Period, which runs from November 1st to January 15th each year. During the Open Enrollment Period, individuals can come in, create an application, review their eligibility, compare plans, enroll in coverage. It, just like it says, is open. So if you've never been in the marketplace before, now is your time to come in and see what you might qualify for. Enrollments that are submitted between November 1st and December 15th will have a January 1st effective date, and enrollments submitted between December 16th and January 15th will have a February 1st effective date. So I always say, get in early. You don't want to have a gap in coverage if you wait to enroll until later during the enrollment period. Now, there are some other times where you may be eligible to enroll through the marketplace, and these are called special enrollment periods. So this would be outside of the open enrollment period, and these are generally going to be based on qualifying life events. So things like losing your current coverage. So if you've got employer coverage and you lose that, or other coverage, then you may be eligible for a special enrollment period to enroll. Other life changes, marriage, birth of a child, adding family members through adoption, and so on. and including things like moving. Now, typically with moving, it is going to have to be outside of your current zip code. So if you're moving across the street, you may not be eligible for the SEP, but if you're moving to a new zip code or a new state, you may. And these are just a couple of examples. There are a lot of qualifying events. So if you do have a major life change, you can always come into the marketplace to see if you are eligible for a special enrollment period outside of that SEP. Effective dates for special enrollment periods do depend on the life change. So for something like moving, like we mentioned, if I were to report a move to the marketplace today, my effective date would most likely be December 1st. If I were to report the birth of a child, then it would most likely be made retroactive to the date of that child's birth. So the effective dates, like I said, do kind of just depend on what the change is. Another key call out here, updates must be reported within 60 days of the life event. So if I moved in July and I'm just now calling, unfortunately, I'm outside of that window to enroll. But if I move in October, I'm within that window. So make sure you are calling within 60 days of any life events. Next, let's talk about, I think everybody's favorite topic, costs. So what are some of the key terms that you need to be aware of when you're looking at your options? So we've got a couple here. Premiums. The premium is the monthly amount that you pay to maintain your health insurance. Deductibles, this is generally going to be the amount that you pay for covered services before your plan starts to pay its share. Co-payments, this is going to be typically a like one-time dollar amount, $20, $25, something like that, for services like just going to see your doctor at their office or something like that. And then co-insurance is going to be a percentage of services covered. So generally, if you were going to have a surgery or something, your plan might cover 60%, and then your co-insurance would be 40% of the cost of that service. We also have on here advanced premium tax credit. This is the amount of financial assistance that you're eligible for on a monthly basis. And then cost sharing reductions are additional financial assistance that help lower out-of-pocket costs. So they might lower your deductible, they might lower your co-insurance. It really just depends on what your eligibility is. As far as advanced premium tax credits go, like I said, that it's the amount that's applied, but it's applied to your premium. So if, for example, you came through the marketplace and were eligible for $200 a month in advanced premium tax credits, and you found a plan that was $300 a month, well, then when those APTCs are applied, you're only paying $100 out of pocket. So really just help to lower the cost of the monthly premium. And again, the cost sharing reductions help to lower the other out-of-pocket costs. And I think we've got another poll here. So if you qualify for cost sharing reductions in the marketplace, which metal level plan would you have to select to benefit from those savings? We'll give it just a minute here. Give it another minute, give everybody a chance to respond. And if you don't know, that's okay. Okay, so we've got bronze, silver, and gold. And if you said silver, you are correct. Well done. To take advantage of cost sharing reductions, you would have to select a silver plan, and we'll talk a little bit more about that here in just a minute. So let's talk about kind of the plan categories as a whole. So the first one we have on here is catastrophic plans, and this is exactly what it sounds like. This is a plan that is set for the worst case scenarios. So generally a plan like this is going to have a much lower monthly premium, but a higher deductible. Catastrophic plans are only available to certain individuals under the age of 30, or individuals who might qualify for a hardship or an affordability exemption. So they are limited. Now they do cover the same essential health benefits as other marketplace plans, and we'll talk about essential health benefits here in a minute. They cover preventive services and 3 primary care visits a year at no cost as well. One thing with catastrophic plans, you cannot use an APTC, sorry, with a catastrophic plan. Now, outside of catastrophic plans, we have what we call the metal level plans. So bronze, silver, gold, and platinum. So each of these plans represents a general amount that you'll pay for care. So with the bronze plan, generally the plan's going to cover 60% and you'll pay 40%. With silver, it's 70-30, gold, 80-20, and platinum 90-10. Now, one thing to note is that this is called an actuarial value. So you might pay more for some services, you might pay less for some services. It really just depends. But generally speaking, the plan pays a close to set percentage of the cost of care. So it's really important to understand what your healthcare needs are and what your budget will be for your care. So with a platinum plan, you are likely going to see a much higher monthly premium, but much lower out-of-pocket costs. So if you are experiencing a chronic issue or you do have a lot of healthcare needs, it may be worthwhile to spend more on the premium monthly and have lower out-of-pocket costs in the long run. Typically, like a platinum plan is going to have a much lower deductible, so the plan is going to start paying much sooner than, say, with the bronze plan, where they'll have a much higher deductible before they start to pay for care. Now, again, back to our poll question, silver level plans are required to use cost sharing reductions. So if you're in a silver level plan and you have cost sharing reductions, your 70-30 split might be a little bit different. So they might pay 80% and you're paying 20%, but at the lower monthly premium. So definitely good to find out what you're eligible for to see if there are extra savings available for you. So we've talked about plan categories. Let's talk a little bit about plan types. And I'm not going to go too much into this, and this is not a complete list of plan types, but I do want to make sure that you've got kind of a high level understanding of the plans that are out there, and kind of what they mean. You can see all of these choices and it can be so confusing to understand, okay, how does that apply to me and how do I make that work for my needs? So looking at the first two, we have health maintenance organizations and preferred provider organizations. And I'm going to kind of use these two as our primary examples, since they kind of cover the gambit of what you might see with these other plan types. So with an HMO, typically you may need to live or work in a specific area. They won't cover you outside of their specific zone. They are generally going to require that you have a primary care physician. They typically have a limited, if any, out-of-network care, which means that if you see somebody outside of their network, they're not paying for that care. Now, there are emergency situations which are a little bit different, but if it was, say, just a preferred provider, the doctor that you like, and they're not in network, then generally an HMO is not going to cover that. They also typically require referrals. So if you need to see a specialist, you'd have to go to your primary care physician to get a referral to see that specialist. Now, PPOs are kind of the exact opposite. With a PPO, they generally don't require you to have a primary care physician, although they do recommend it. They may cover out-of-network providers. Now, you're going to typically pay a little bit more to see an out-of-network provider, but they're going to cover some amount of that cost. They generally do not require referrals. So a couple of differences between those two types of plans. So you might pay a little bit more for a PPO versus an HMO. The other plans that I've got on here, point of service and exclusive provider organization, they're basically some variation of those first two plans. Is it a referral? Is it not a referral? Do you have to have a primary care physician? Do you not? It all kind of depends on the plan type. The only one here that's a little bit different is a high deductible plan. A high deductible plan is similar to a catastrophic plan, but not a catastrophic plan. It typically is going to, like it says, have a higher deductible. Also you can generally use a health savings account with a high deductible plan as well. So I'm mentioning this because, again, it really depends on what your healthcare needs are. So if you, like I said, see a lot of specialists, then an HMO might not be the plan type for you. If you've got a set list of providers that you really like to see, then a PPO might be the way to go, even if it costs a little bit more. Okay, let's move on. And I mentioned before essential health benefits. So we're going to just run through real quickly what the 10 categories are of essential health benefits. And keep in mind that all marketplace plans are required to cover these 10 essential health benefits. So the first one we have on here is ambulatory services or outpatient care. So the type of services you get without being admitted to a hospital. So like a doctor's visit, a clinic, things like that. Emergency services, just like it sounds, if you end up in the emergency room, something happens, then that's covered. Hospitalization, any surgeries, overnight stays at the hospital, pregnancy, maternity, newborn care, this is both before and after birth, mental health and substance use disorders and services, and this includes any behavior treatments as well. We also have prescription drugs, and I want to call out here real quickly that it is categories of drugs, not necessarily brands. So plans are required to cover a wide array of categories of drugs, but not necessarily the name brand of that drug or specific types of that drug. You definitely want to make sure if you have specific prescription needs that you are checking with your plan to find out what their formulary is to make sure that those are covered. So we also have rehabilitative and habilitative services and devices just to help with things like disabilities or chronic conditions, lab services, tests, blood work, all of that's covered, preventive and wellness services and chronic disease management, and then pediatric services, including dental and vision. Now, another call out that we want to do right here, dental and vision care are only required for pediatric services. So there are some plans that might offer dental benefits or vision benefits, but they're not required. There are also standalone dental plans that are available through the marketplace. So if you find a health plan, you really like it, but it doesn't have dental, you can look and compare dental plans as well to see if there's one that fits your needs. The APTC, that advanced premium tax credit, cannot be applied to dental premiums. So that will be an additional monthly cost to occur. But again, if you need it, it's worthwhile to look and see what's available. Now we want to talk about some assistance options. Healthcare is confusing, especially if you're coming into something like the marketplace for the first time, then even knowing where to start can be a little bit tedious. So let's talk about some of the options and individuals who are available in your area that can help you. They can help with general questions, they can help with applications, really just a lot of support available. The first of these is navigators. Now, navigators are going to be free, unbiased assistance. They're typically going to work with some sort of organization, oftentimes a nonprofit organization. They can help answer questions, they can help fill out the application, really the full scope of needs with the marketplace they can help with. And actually really neat that we've done some major funding for navigators. So we're actually working to get more navigators trained, get more people available in communities to help out with enrollment questions. So pretty cool. We also have certified application counselors. So similar to navigators, they're going to be able to help you with your application, help with general questions. They do have to be certified by the marketplace, and they must be associated with an entity, some sort of business, usually a community health center, that is also certified by the marketplace. Consumer assistance programs are like navigators. They are just in state-based exchanges. We also have agents, brokers, and web brokers. These are individuals that are typically associated with one insurance company or maybe a group of insurance companies. They can help with the full range of questions through the marketplace, but really their knowledge is going to be in the available plans. So if you're looking for specific coverage, you have specific needs, they can help you identify the best plan to really fit those needs. One thing to note with these individuals is they generally are going to receive a commission. So they might work with somebody like Blue Cross Blue Shield specifically, and they're going to know everything about Blue Cross Blue Shield plans, but they are also working on commission for Blue Cross Blue Shield. So just something to keep in mind. We have I'm going to say healthcare.gov so many times, a very cool feature on healthcare.gov. It's called Help on Demand. So if you know that you just need some extra help getting started, but you don't even know how do you find a navigator, where's your community health center, the Help on Demand feature on healthcare.gov is going to help you find individuals in your area that can help you. And then, of course, I'm biased, but this is my favorite, the Health Insurance Marketplace call center, who I work for. We can help you with general marketplace questions. We can help you with your application, eligibility. We can help you understand everything marketplace related. Now, I mentioned at the very beginning that we are not actually the issuer, so we are not a provider. So we can't help with things like payments, and we can't help with things like healthcare claims, but anything specific to the marketplace, we can assist you with that. And you can find our number on healthcare.gov. Okay, a couple of things that I wanted to mention before we get really into that enrollment process, a couple of new this year features and regulations that have passed. The first of these is what's known as employer coverage affordability changes, and this addresses the family glitch. And you might say, hey, Jess, what's the family glitch? So the family glitch is an affordability gap in the marketplace. So when somebody comes in and submits an application through the marketplace, the application asks if you have employer coverage. So if you say yes, you have employer coverage, the application asks you to do what's called an affordability worksheet, and it basically determines if your employer coverage is considered affordable. So if your employer coverage is considered affordable, you're not eligible for an APTC or financial assistance through the marketplace. If it's not considered affordable, you may be eligible for both. So what has happened in prior years is that this affordability was only based off of the individual employer coverage. So if I'm married and I've got kids, and we have health insurance through my employer that covers me, my spouse, and our kids, the application was not taking that into consideration. The application was deeming affordability by the individual only, which unfortunately meant that for some people, for some households, their coverage was deemed affordable based on individual when the family plan would not have fallen into that same affordability scope. So clear as mud, right? So this year, with new IRS regulations, the application is now calculating affordability based on family plans as well. So millions of people who in prior years were not eligible may now be eligible because of this change. So very cool change. Really excited to see some folks come back into the marketplace who may have had prior experience with us and now see that they're eligible for that additional assistance. So very cool update. We also have new security code settings. These are, you might know them as like multi-factor authentication, two-factor authentications, really just additional protections on healthcare.gov to make sure that your information is secure. So just like you might see with Google, right? If you go and log into your Gmail account on a new phone, it's going to say, hey, we sent you a code, enter this. And that's now available on healthcare.gov. So you can sign up for text messages, emails, or I think a phone call as well to get through that multi-factor process. So very cool. And then the last one, which I am personally very excited about, are updates to the Plan Compare tool. So the Plan Compare tool is where you go to look at all of the plans available in your area. You can compare them, you can see them side by side. It just is a great way to be able to understand your options. Well, this year, they've really worked hard to kind of redesign some of the features in the Plan Compare tool so your options are clearer. There are new filters. So if you have specific needs or a specific plan or a specific price range, there are new filters that you can go and look for the plans that meet those needs. We also have new easy pricing plans, which have a little green sticker by them to help you identify them as easy pricing. And then we have new and clear additional help text available. So if you're reading through and you see a term that you don't understand, you can click on a link and it'll take you to clearer language. And then it didn't make it on here, but it should have, is push messaging, is lack of a better term, right? So if you are eligible, say, for those cost sharing reductions, and you have to select a silver plan, right, to take advantage of those, and you were to go through Plan Compare and you were to select a bronze plan and try to continue to enrollment, healthcare.gov is going to say, hey, hold on a minute. We see that you're eligible for cost sharing reductions. Do you want to look at some silver plans before continuing with this bronze plan? So really great features to make it so much easier to understand your healthcare options, to make sure that you're taking advantage of any of your eligibility for additional financial savings. So a couple of very cool updates for this year. And honestly, this slide probably could have been 2 or 3 slides with the amount of amazing changes that they've made. So we have another poll question. Where would you go online to create a Marketplace account? So we'll give it just a minute here. Another couple of seconds. Okay, so healthcare.gov, cms.gov. Okay, so I'm really happy that everybody chose .gov websites. You're probably going to hear me say this again, but if you get emails or marketing from a website that does not end in .gov, please don't click it. Please always look for .gov. If you selected healthcare.gov, you are correct. Well done. So let's move forward and talk a little bit more about what it means to create an account and how you can prepare to enroll in Marketplace coverage. So preparing to enroll, step 1, create an account on healthcare.gov. If you see healthcare.org or marketplace.com, please look for the .gov. We see so many folks who see those ads, paid for ads on Google, and they'll go to that ad thinking that they're coming to the Marketplace, and unfortunately they're not. So always check for .gov. Creating an account is pretty simple. It's pretty seamless. It will, when you log or when you go to healthcare.gov, I think there's a big green button that says want to create an account, and it'll walk you through that process. You'll also want to gather basic information about your household. What's the income for your household? What's your citizenship status? What's your employment? And then any current health insurance information right now. So like I mentioned, job-based coverage, you're going to want to know the details of those before you come in through the Marketplace. Learn about the various options available to you. And we've talked about the metal levels and those plan types, but also just who are the issuers in your area? Who's available in your area? We've got another great tool, the window shopping tool on healthcare.gov that will help you find out what's available to you. So it'll ask you a couple of generic questions like put your income in, what size is your household? It'll let you actually add in any of your providers, your doctor, your hospital. You can add that in as well, and it's going to show you plans. Now, one thing I do want to call out with the window shopping tool It is just a high level calculation. So your true eligibility will be calculated in the application, and it might be different than what you see in the window shopping tool. So just keep that in mind. It's great for seeing the plans available to you, but it's not 100% accurate with what your actual eligibility will be. Find out if your providers are accepted by the plans. Again, this is that network, and this is so important. If you have providers that you've been seeing long-term, call them, call the plan. We do have a network on healthcare.gov, but plans are responsible for maintaining that network. So if a doctor, if a hospital were to have recently dropped out of that network, it might not be up to date on healthcare.gov. It can just take some time for those things to be processed. So make sure you are calling the plan, make sure you are confirming that your preferred providers are in that network. And I've got it as a sub bullet with a note with an exclamation point: call the plan, make sure that they're in network. Keep an eye out for notices, especially if you've been through the marketplace before. There are several healthcare.gov notices. So specifically to the marketplace, you might see stuff from us. There are issuer notices, all sorts of notifications go out, especially around this time of year, that have information about plans, about availability, and about enrolling. So make sure you check on that. And then finally, be aware of fraud. And this is, again, why I said watch out for those .gov websites. We combat fraud all day, every day. So just be aware of fraud and make sure you're going to those reliable sources and websites. So applying for coverage, it's a somewhat long process. Just make sure that you get all of your information in there, and that makes it sound so bad. It's not a long process. It just is making sure that all of your information is input, your income information, like I said, your citizen information, everything for your entire household. And you'll complete the application. Again, you can do this on healthcare.gov. You can give us a call at the Marketplace call center. And I've got it listed on here. There are some sections that can get a little confusing. So use that help language that I mentioned earlier. And this is sometimes hard to do, but trust the application. So the application will change depending on how you answer questions. So trust it to get you to the right place and to the right eligibility. You also want to answer questions completely and honestly. Your eligibility is dependent on how you answer those questions. So want to make sure that you're answering it as honestly as you can. And then I would say this as well: if you can sit down and do the application in one setting, be prepared, sit down, do it in one setting. You can't pick up where you left off. Every time you come in, it is going to kind of kick you back to the start to make sure it has all the right information. So if you can sit down and do it in one setting. Okay, so now let's talk a little bit about your eligibility. So after you submit an application, you are going to see an eligibility snapshot on healthcare.gov, and then you're also going to see a link, a little PDF link to an eligibility determination notice. So you want to read both of these things in their entirety. They're going to have details about any next steps. They're going to have details about if you need to provide additional documentation to support something you put on the application. If you don't think your eligibility is correct, they're going to have information about how to appeal that eligibility. So really important that you are reading through it. They actually recently, I think last year, updated the eligibility notice. So it's much friendlier now to be able to see what your eligibility looks like. Then once you know what your financial assistance is, what you're eligible for, you can set your financial assistance usage again on healthcare.gov. So one thing is your financial assistance is based on kind of several factors, but a big part is the household size and income. So when you get to this slide, it's going to say, do you want to use all of your premium tax credit? Do you want to use some, or do you want to use none of it? If your income has been the same for 20 years, you know exactly what it is, then it's absolutely safe to use all of the financial assistance. If you kind of guesstimated your income and you think that you've got it correct, but you're not 100% sure, you might want to use a portion of, maybe not all of the financial assistance, just in case when you file your taxes, if your income is off a little bit, you may have to pay back part of that APTC that was used. So just kind of, like I have said several times, know your situation and kind of plan accordingly to that. Oh, and I do have it on here. So when you file your taxes, if the income that you put on the application does not align with other sources like the IRS, you may have to pay back part or all of that premium tax credit. You'll then answer some questions about tobacco usage. And once you've kind of gone over this general information, it's going to take you to the enrollment options. So when enrolling in coverage, compare plans. I would say don't just look at the cheapest plan and say, yep, that's the one for me. Look at all of the options available to you. I'll say it 100 times. What's the most important to you? Is cost the most important to you? Is coverage the most important to you? Is convenience the most important to you? Because if you just pick the cheapest plan, the first plan that shows up, you might not have somebody, within 15 or 20 minutes of you. Their network might be, a hospital that's 45, 50 minutes away. So keep those things in mind. I always recommend including providers and prescriptions in the plan compare tool to remember they are covered. Now, again, call the plan. If you find a plan, you really like that plan, you think it's going to fit all of your needs, the phone number is going to be available right there in the plan compare tool on healthcare.gov. So call them real quickly and just have them confirm that your preferred providers are in network. Use the filters. There's so many great filters. If you know that you've got a certain premium amount that you want to look at that you just know you can't go over, you can use those filters. But I would also play around with it, right? You might see that by spending $50 or $100 more a month, your deductible is going to be cut in half. So play around with the filter options. If you're eligible for cost sharing reductions, take a look at those silver plans. If there are specific services or specific needs that you have, call the plan beforehand to get an understanding of the cost. So there on healthcare.gov, there are also plan brochures, which will kind of give you a better understanding of what kind of the pricing is for each individual plan. But I always say contact the plan with any specific needs. Review the attestation language. In the enrollment process, I think there are 3 or 4 bulleted attestation paragraphs, and they're really important to understand what might happen with your health insurance in the future. Excuse me. So one of the bullets, you're allowing the marketplace to auto enroll you for the next year, which is a really awesome feature. It kind of takes some of the pressure out of coming back in, right, to pick a new plan. So you might be auto enrolled. There are some bullets that talk about the fact that, if you get other coverage, you're going to want to call us back and you're going to want to end your marketplace coverage. And there's a bullet that talks about Medicaid eligibility. So just a couple of things to keep in mind, but read through those bullets and take time to really understand them. And then you get to enroll. Big green button. Click the enroll button. Now, again, like I mentioned before, if you're eligible for silver and you choose a different metal level, it's going to try to push you back to silver to make sure you're taking advantage of all of the financial assistance that you're eligible for. And then I mentioned on the first slide, but I'll say it again, the enrollment submitted during the open enrollment period will be for either January 1st effective dates or February 1st effective dates, depending on when you enroll. If you're not eligible for an SEP, you cannot enroll in 2022 coverage any longer. After your enrollment is submitted, your plan will send you plan documents and your cards, and then you'll want to make your first payment directly to your plan as well. A couple of important reminders for today. How many times can I say it? It's important if I say it more than twice. Call the plan with questions about covered services and their network. The last thing you want to do is pick a plan, get enrolled, get your payments set, and then come March, you try to go see a doctor that you saw once before, or a specialist that you saw once before, and they're not in that plan's network. So make sure you know your network. Check your eligibility notice for data matching issues. So data matching issues are what happens if the information you provide on the application doesn't align up with other federal data sources. So we check information against the IRS, the Social Security Administration, the Department of Homeland Security for like your citizenship and whatnot. So if the information you provide doesn't align with those other entities, then we are going to ask that you submit documentation proving that what you said to the marketplace is accurate. So definitely, like I said, check your eligibility notice. It will have next steps. It'll have documents. It'll tell you where to send it. I mentioned this before, and I want to say it again. You have the right to appeal. If you believe your eligibility is incorrect, you absolutely can appeal those eligibility results. It is in the eligibility results how to do that. On healthcare.gov, there is an appeals form that you can print out and you can fill out and send back to us as well. Don't forget to make your payment. Now, like I said, you can't make a payment to the health insurance marketplace. You have to make it directly to the issuer. And then keep an eye out for plan documents. If it's been several weeks or a month or more than that, and you haven't received your cards yet, you haven't received your plan details yet, you can call us at the marketplace. We can take a look and see what's going on, or you can call your plan directly to make sure that they've got the enrollment and that it's been confirmed. And then report any life changes that occur throughout the year that may impact your coverage. We talked a little bit about the APTC and having to pay that amount back. If your income is reported, say at the beginning of the year, you don't know what you're going to make, you're not working a bunch of hours right now, so your income's a little bit lower, and then come April or May, you get a better job, you get a big promotion, make sure that you report that back to the marketplace and that you update to see what your new eligibility is based on that income. So I think that about wraps it up for us, Amy.
Thank you so much, Jessica. Thank you. That was a lot of great information. And we had some questions, though, but it was a lot of information, and I think is going to be really helpful to our viewers. So let's just start with some of the questions that came in. One did come through the chat. So when you mentioned household income, does that include the income of parents of an adult child living in the home who wants to get a policy of his own?
That's a really great question. So what you're talking about is what we call a multi-tax household. So there's kind of two things that come into play. Is your adult child claimed on your taxes? And is your adult child over the age of 26? So if your adult child is under 26, they're living at home, then you can include them on your application and you can include their income as well. If they file their own taxes, it gets a little bit tricky, then they will have to create their own application. However, they should include you and any other family members as non-applicants in the household. And you, on your application, should include that adult child as a non-applicant for your household as well.
Yes, thank you. Yes, that was a great question. The next question here, if I lose coverage in the middle of the year because I couldn't afford my premium, would I qualify for a special enrollment period for non-payment of the premium?
For non-payment of a marketplace plan premium?
Yes.
Okay, so that's another great question. And the regulation just changed. So I don't have it in front of me right now. So I'm going to say tentatively, yes, I believe that would qualify you with new regulations for a loss of MEC or minimum essential coverage special enrollment period. You will still have to pay back anything that you owe to the prior insurance company. So the new regulation says they can't block you from a new enrollment, but you do still owe whatever premium amount was due prior.
Thank you. That was a great question. This next question says, so the resources you provided, the navigators, certified application counselors, agents, brokers, this question is asking, are those individuals Do they get paid for assisting?
So yes, and no. So helpful, right? So people can volunteer to become a navigator, but there are also people who can get paid to be a navigator as well. So the great thing about those individuals is that they have access to a lot of training. So they're going to be up to date on information, on new regulations. As things are rolling out, then they're getting trained on that as well. But to answer the question, yes, they may be getting paid.
Okay, great. Um, this question says that I am a caregiver. Am I able to apply on behalf of someone else?
That's an awesome question. Yes, so you can apply on behalf of somebody else. You would be considered the application filer. So when you first get into the application, it asks about contact information, the very first screen of the application filer, and that's who you would be. Now, again, it kind of depends on the household. I don't know that you would want to include yourself on the application if you're not part of the household. But just as a caregiver, yes, absolutely, you can do so. Oh, I will say, sorry, Amy, you're going to want to make sure that you're authorized as well on that individual's record. So they may have to give authorization for you if you're going to follow up on their healthcare needs or have to call to ask questions or what.
Great. Thank you so much, Jessica. If I enroll in a plan by 12/15, but change my mind before January 15th end date, can I enroll in a different plan?
Oh, I love this question. Okay. Yes, you can. So it's going to look a little bit weird because you'll have what's called a canceled segment. So you might still get plan details from the first plan that you enrolled in, but since it didn't become effective, it's a canceled plan. But yes, you can.
Great. Thank you. Um, does the open enrollment period apply to ACA plans sold directly from an insurance company?
So you cannot get an ACA plan directly through an insurance company. We do have what's called direct enrollment partners, where they will have a setup that kind of ties into healthcare.gov, but it's still through healthcare.gov. So it might be like, I'm going to use Blue Cross again, right? So Blue Cross Blue Shield's website, they'll have a platform specifically for Marketplace health plans, and their platform will tie directly into healthcare.gov. So everything they're doing is still coming through us, but it's still an ACA plan. Does that make sense?
Yes. What are the options for coverage if your income is too low to qualify for the APTC, but you live in a state that is not expanded Medicaid?
Yeah, this is really the Medicaid gap is what we call this, right? So it's a really unfortunate situation where in those instances, you can maybe qualify for something like a catastrophic plan. I will say that the American Rescue Plan has really helped to kind of bridge that gap in some states. So they've changed the way the FPL, right, the federal poverty level is calculated in the application. So unfortunately, through the marketplace, there are just not a ton of options. So community health centers are available for additional needs. You can always apply and just see what you qualify for. But outside of that, unfortunately, I don't have any other options.
Okay, thank you. This question is asking, what if I don't use a computer? How can I review the plans available to me?
Yeah, I would say call us, give us a call. We've got customer service representatives that can pull up the information. You can tell them about your specific needs. You can tell them about your providers, all the things that you would do on your own using a computer. You can work with our customer service representatives to do. So just be really clear with them that, you don't know exactly what you want. You have a budget, you have some specific needs, and they can work with you and use some of those filters on your behalf.
Great. We do have this question that's asking, how do you sign up to be a navigator?
Oh man, that is a great question. I don't know the answer off the top of my head, but I do know that if you go to healthcare.gov and you search for navigator, it will have instructions. So it'll tell you what a navigator is, and then at the bottom it says you want to be a navigator, and then it has a link that will take you to more resources.
Um, this is an interesting question, but it's asking, when they call in, the call wait times are so long. Is there a way to get around the wait, like maybe specific times to call the marketplace or?
Oh, that's a good one. So I would say avoid peak hours. There are those time frames, lunchtime, right? When people first wake up, lunchtime, and then when people are getting off work, those are the times that we a lot of times see those spikes in volume. So later in the evening, typically earlier in the morning, kind of outside of those peak times would be the best time to call us.
Okay, great. And this question is asking, what if I cannot find my specialty medication when entering the medications on healthcare.gov if my medicine's not located there? What do I do next?
Yeah, that's a really good question. So again, I would say call the plan. If you find a plan that you're interested in, then you can call the plan and see if there is a specialty medication. If they don't cover it, there is an option to request a formulary adjustment. I don't think that's the right word for it, but basically you can say, hey, this is something that I need covered. This is a prescription that I need. And then you're basically appealing to the plan to cover that for you if they don't already cover it. There's not a guarantee that they will, but you can always call the plan and exception. That's what it is, formulary exception. You can always call the plan and see if they will.
Great. And I think we have one last question. And for any others we didn't get to, we'll try to reach out to you to answer your questions via email. But this question is just asking if my income changes in the middle of the year after I've put in my application and maybe gotten credit, can I update anything to get maybe additional savings?
Yes, absolutely. If you have any life changes, let us know. If your household grows and your income changes, let us know, because you might be eligible for more or you might be eligible for less, but you want to know that now rather than when you file your taxes and you're owing back some of that APTC amount. Yeah.
Yes. Well, I think that's all. We're going to wrap up this webinar. A lot of great questions, everyone. Thank you, Jessica, again for being here today. The detailed information that you presented will be extremely helpful to those navigating the Marketplace Open Enrollment period. It also provides our viewers with an understanding of just how complex searching for a plan can be. And the more we know, the louder our voice can be. Thank you, everyone, for joining us here today. We do encourage you to complete the brief survey that you'll receive after the webinar. It does help us to ensure that we continue to provide helpful information and content to you. If you are not already doing so, follow us on social media at Accessia Health to learn more about other presentations and upcoming webinar series. Thank you again, and we look forward to your feedback. Have a great day.